Hi class, today I'm going to be talking to you about melanoma, which is one of the most dangerous forms of skin cancer. The reason why I'm talking to you about melanoma today is because I'm from Florida and I actually know quite a few people who have gotten skin cancer, and I think it's important to be educated on the topic. So what melanoma is basically is the formation of a tumor on your skin. It can be made out of melanocytes, which are the cells that produce melanin, and that gives your skin a darker pigment. Those most at risk for melanoma are those who are fair-skinned, redheads, and people who are in the sun more often. According to the Mayo Clinic, the most common areas to find a melanoma are on your arms, your legs, and your back, and those are basically places that the sun hits most often. And those with a darker complexion, you can find melanomas on palms of your hands, the soles of your feet, and even underneath your fingernail beds. Early signs of a melanoma include the formation of a new mole or the change in an existing mole. New moles are pretty common, but you should definitely check them out just to make sure that they're not cancerous. One way to do this is by using the ABCDE test, and this involves basically assessing the mole's appearance. The A in this test stands for asymmetry. Usually moles are pretty symmetrical if they're normal moles. Cancerous moles like melanoma, they can be asymmetrical, so keep an eye on that. The B stands for border. Usually normal moles have a pretty distinct border, and cancerous tumors, you often can't tell where the skin ends and the mole starts. The C stands for color. If there are multiple colors in your mole, that can be cause for concern because cancerous tumors usually are multicolored. The D stands for diameter. If your mole is larger than the eraser of a pencil, then you might want to go get that checked out because it can possibly be cancerous. And one of the bigger ones is evolution. That's the E. If your mole starts to grow or change in any way, shape, or form, then definitely go get that checked out because it can possibly be cancer. The treatment for melanoma involves often removal of the tumor, which can be done by excision, or sometimes surgeons can use a blade that's circular and basically punch out the tumor, like a 3-hole punch almost. If the cancer is spread past like the skin to the lymph nodes, perhaps, usually they will have to remove the infected lymph nodes. Other forms of treatment involve immunotherapy, radiation, and chemotherapy. According to the Skin Cancer Foundation, there are multiple different stages of melanoma. Stage 0 involves the tumor on only the top layer of your skin, which is the easiest way to treat melanoma. The stage 1 involves the penetration of the second layer of skin, which is still pretty easy to treat, but it's not quite as easy. The second stage, stage 2, this involves the tumor being deeper than 1 millimeter, and it can be ulcerated, which means that the cancer can spread easier if the tumor is ulcerated. Stage 3 involves the spread of the cancer to the lymph nodes. Usually, if your cancer has spread to your lymph nodes, your doctor can palpate them, and that's usually an indicator that the cancer has spread. Stage 4 involves the spread to the lymph nodes if they haven't in stage 3 already. It also involves the spread to other organs such as the liver, the brain, and lungs. So, thank you.